Hello and welcome back to the Patients First podcast. I'm your host, Dr. Bryan Laskin. And as always, I am excited that you're here. And you're wondering, why do you not have your screen up? Why is there an empty chair? It's because we have some guests coming in and I just wanted to. I was very passionate to get this podcast out to you before the end of 2023. Why? Because this is going to be hopefully my annual predictions. What did I get right in 2023? What did I get wrong in 2023? And what are my predictions for dentistry for the year 2024? So it's not easy to do, but I have just as many predictions in 2023 that I got wrong that I got right. So let's go through them. Number one, what did I get wrong? I think the biggest prediction that I made in 2023, if you listen to my podcast, if you've been listening for 12 months, the biggest prediction that I got wrong is that the COVID infection control measures would not revert back to 2019 levels. I thought that the infection control protocols, the extra infection control policies, procedures, the barriers and things that we put in place, not all of them, but if you told me in the beginning of the end of 2022, beginning of 2023, that 100% of the infection control protocols for COVID would be peeled back, or at least 98% be peeled back in the year of 2023, I would have thought you were nuts. I would have thought that there would be not 100% lasting infection protocol change, but that there would at least be a fundamental shift in how we viewed infection control. And right or wrong, I got that wrong. I think that in a lot of practices, things have gone back to the way that was in 2018 or 2019. Is that a positive or a negative? I don't know, but I missed the boat there. I thought that those infection control protocols would be here to stay. And I think in most offices, they haven't. If you disagree with me, if you think that this is a great thing, that we're back to pretending like COVID didn't exist and we're going back to 2018 levels of infection control, or if you think, hey, we've kept those in my office, I'd love to hear from you. Like, comment, subscribe below. But that's my feeling. In the practices that I visited, the places that I've participated in delivering dentistry, it seems like things are going back to the 2019 levels, that the infection control measures put in place for COVID-19 have been peeled back in way further back than I anticipated while going through the COVID pandemic. So what did I get right in 2023? Well, we've been focusing a lot on this podcast on DSOs. Why? Because there's massive consolidation that's been happening. And in fact, I would say this is a right and wrong. I was right that the DSOs and group practice is growing at a shockingly large rate. What I got wrong was it's even moving faster than I had thought. The data is pretty clear on this, that there's a mass consolidation that's going on in the dental industry. Even DSOs are buying each other and things are moving at a very, very fast rate. So I put this in the I got it right category because I didn't say the rate of which it was going to happen. I just said it was going to happen at an acceleratingly fast rate in 2023. And that is definitely the case. It's even moving faster than I would have predicted. Another thing that I got wrong at the end of 2022, coming into 2023, the number one technology that dentists were looking at was 3D printing. And I thought, boy, 99% of dentists should buy something before getting a 3D printer. And this was another thing that I would put in the right and wrong category. I still believe that most dental practices should be looking at easier technologies, things like interoperability or paperless forms or online scheduling, or the easy things to cater to patient convenience prior to getting a 3D printer. However, the 3D printing technology is moving at an accelerating rate. So whether or not you're using a 3D printer in your practice or a 3D printer from a laboratory, I think that 3D printing is an emerging technology that we're going to be using a lot more and more going forward. So not that, again, I think I got this right. I still think that 3D printing isn't the number one priority for most offices. However, I do feel that more and more offices should be looking at the technology as they incorporate other technologies too. The big thing I think I got right, if you go back and you listen to the beginning of 2023, is that profitability in dentistry is at risk because of the wage inflation, inflation in general, the cost of goods, and our inability to raise our fees. I see profitability in the average dental practice being squeezed hard right now. Also, in the camp of, unfortunately, I got that right. Another thing that I got right is I felt like the lack of quality team members in our industry was going to be with us for the entire year. And I would definitely say that that was the case. So, those are the things that I think I got right and wrong for the year 2023. If you agree with me, please let a note, put a note in the comments below. If you disagree with me, definitely let me know. If you think I got something wrong that I think I got right, or flips or the opposite, I'd love to hear your thoughts and your comments, and of course your predictions for 2024. I'd love to hear what you think when we're sitting at the end December 31st, 2023, and we look back on 2024. What do you think are going to be the trends? What do you think how dentistry is going to be slightly different or fundamentally different through the next 12 months? Here are mine. I have four. Number one, I think AI is going to continue to explode in dentistry in a positive way. Now, that almost sounds like a gimme, right? I mean, it's pretty obvious. So, what do I mean by that? I think AI is going to be used more to predict treatment, diagnostics, what procedures we are doing in our offices. We'll be able to tell a lot more what's going into our practices based on leveraging AI. And I think AI will be able to do things like look at all of the research studies that have been done in dentistry and make predictions. So we'll have some outcomes through leveraging AI in this next year. And we all know that 12 months in the world of AI is like 24 years in other aspects of even in technology today. So AI is moving so much faster. I think that there's going to be new ways to leverage AI to help our practices that we can't even think about today that will be obvious to us at the end of 2024. That's prediction number one. Prediction number two, if you listen to the podcast, you probably know that I'm going to be saying this, that interoperability, that exchange of data is going to be the next big thing in dentistry. 6 months ago, I had never heard anybody other than this podcast talking about interoperability. And in the last few months, I've seen it as a theme at many dental meetings. And I think by the end of 2024, it's going to be the next big thing, kind of like AI is right now and 3D printing was at the end of 2022. So, interoperability in December of 2024, I think, is going to be the focus for most people's minds in the industry. I wrote the whole book about it, but I think 2024 is a year that it becomes sort of generally talked about and sort of at the forefront of dentistry. Not yet, not in January, not right now, but at the end of the year, it's going to be the next big thing. And obviously for me, that makes me very happy to predict because it's we've been working on it for about 3 years over here. But there's a lot of trends that's going on that I think 2024 is going to set up probably 2025. This might be the year. Last year set up the 2023 is setting up 2024 to be the year of AI. I think the same thing is happening with interoperability, so that by the end of 2024, we'll be looking at 2025 as the year of connected dentistry. That's my prediction, number two. Prediction number three, that DSOs will not consolidate as quickly in 2024, that they're going to be focusing on how do they grow their practices. Now, for those of you not in the DSO industry, that might be shocking. For those of you in the DSO industry, that might be obvious. But I also predict that DSOs are going to have a very, very difficult time growing their dental practices, switching from an aggregation model to growing their individual practices is going to be difficult for, I think, a lot of DSOs that don't have a lot of clinical leadership. So a 3.A or 3A, 3B of DSOs focusing on growing practices, I think that the dentist-led DSOs will grow at a disproportionately higher rate than non-dentist-led DSOs. Let me say that again. The fact that traditionally DSOs have grown through aggregating practices, not necessarily growing the practices that they own. If there's not strong dental leadership, meaning people who have had experience in growing dental practices, which are typically dentists who are forming these DSOs, will grow at a slower rate than DSOs that are led by dentists who come from a history of growing dental practices. Growing dental practices is a very, very, very dental. A single office growth is a very different business than aggregating a bunch of dental practices and then reselling them at a higher multiple. So, and I believe that dentist-led DSOs are probably better at growing a single practice, right? Why? Why? Because they focus on patients, they focus on care, they focus on doing the things that get patients to say yes to the treatments that matter, case acceptance, and all the things that we do every day as clinicians. So, my prediction number 3 is that DSOs will all be focusing on growing individual practices much more so than aggregating them. But the offshoot of that is that the DSOs that are led by dentists will grow at a faster rate. That is a controversial statement, my friends. Hopefully you fall. Rick Rubin says the best art divides the audience. If you believe with me, let me know. If you don't believe me, definitely let me know. I'd love to debate that with you. And lastly, my fourth prediction for 2024, it is also going to be the year of standards. We've been working on standard development over here at the ADA and DSI, and I believe that it's going to be a year where we have a fundamental shift in the industry, ignoring standards to really understanding the value of them. So while I do believe 2024, at the end, we're going to say this was a year of AI explosion in dentistry, it is going to set up for 2020, the end of 2024, and really 2025 to be the year of standards and interoperability. Interoperability standards are a big part of that, but also standards on insurance adjudication of claims. Like how can we streamline the sort of chaotic, archaic way that we have claims processed in dentistry today. So those are my 4 predictions for 2024. AI will continue to explode. Interoperability will be becoming the next big thing. DSOs will focus on same single practice growth in profits, and it will be more effective if that DSO have a strong clinical leadership. And number 4, that standards will also become a big topic in dentistry towards the end of the year, and also coupling with interoperability as being the next big thing in 2025. Do you agree with me? Do you disagree with me? Please let me know. If you like, please subscribe. And of course, as always, look forward to seeing you right here next week on the Patient First Podcast.